Lymphoma, Hodgkin's, non-Hodgkin's, indolent, aggressive, B cell, T cell. If all that sounds overwhelming, I get it. When I was diagnosed, it felt like a foreign language. In this video, I'll break it down simply. What lymphoma really is, the different types, how doctors diagnose it, and what treatment usually looks like, with a little of my own story woven in. Hi, I'm Joey, and I share my real cancer journey to help other patients, caregivers, and survivors feel a little less alone and a lot less afraid. I'm living with follicular lymphoma, which is a slow-growing form of non-Hodgkin's lymphoma. And today I want to help make sense of all these medical terms. So let's start at the beginning. Lymphoma is a cancer of the lymphatic system. That's part of your immune system, the network that helps fight infection. It starts when certain white blood cells called lymphocytes begin to grow out of control. There are two main families, Hodgkin lymphoma and non-Hodgkin's lymphoma. Most people, like me, have non-Hodgkin's, which is actually a big group of about 60 different subtypes. Within these, you'll hear about B cell and T cell lymphomas. That just means which type of lymphocyte became cancerous. Most are B cell. Then there's how the disease behaves. Indolent lymphomas are slow-growing. Aggressive lymphomas grow faster and need treatment right away. And finally, doctors sometimes describe the amount of disease as low burden or high burden, meaning how much lymphoma is in the body and how much it's affecting your health. Symptoms can vary a lot, depending on the type and how active the disease is. Some people with slow-growing, low-burden lymphoma might not feel anything at all. They may find out through a routine scan, but others, like me, have symptoms that slowly creep in and start affecting daily life. The most common ones are swollen lymph nodes in the neck, armpits, and groin, ongoing fatigue, night sweats, itchy skin, unexplained weight loss, fevers or chills, and or a feeling of fullness or pressure in the belly. Even though I have indolent lymphoma, it was high burden and acting aggressively. Aggressive lymphomas tend to show up more dramatically, with fast-growing nodes, fevers, and pain. Hodgkin's lymphoma often affects younger people, and some even feel pain in their lymph nodes after drinking alcohol. A strange but real symptoms doctors recognize. Once doctors suspect lymphoma, diagnosis usually starts with a physical exam and blood work. Blood tests can help rule out other issues, but they can't confirm lymphoma. For that, imaging and a biopsy are key. CT scans and PET scans help doctors see where lymph nodes are enlarged and how active they are. But the biopsy, where they remove a small piece of tissue, is the only real way to confirm lymphoma and identify the exact type. In my case, I had a core needle biopsy under my right arm. The tissue went to pathology, where specialists looked under a microscope to see what kind of lymphoma cells were there. That's how they confirmed follicular lymphoma, a slow-growing B-cell non-Hodgkin's type. Then comes staging. And this part can sound scary, but it's very different from other cancers. Stage 1 means one lymph node region, or a nearby area. Stage 2 means a few, all on one side of the diaphragm. Stage 3 means both sides. And stage 4 means it's in the organs like liver or bone marrow. But here's the key. Even stage 3 or 4 lymphoma can often be treated successfully, and many people live long, full lives with it. Staging doesn't always predict your outcome. It's just a map to guide your doctor's plan. Treatment depends on the type, the speed, and how much it's affecting you. For indolent lymphoma, sometimes doctors recommend watch and wait, meaning no treatment yet, just close monitoring until it's needed. When it's time, treatment might include immunotherapy drugs that help your immune system find cancer cells, targeted therapy, or sometimes chemo combined with immunotherapy. Indolent lymphomas are usually not considered curable, but they are very treatable. Many people live long, full lives, managing it successfully over time. For aggressive lymphomas, treatment usually starts right away, most commonly with chemoimmunotherapy, and many are actually curable. For Hodgkin's lymphoma, cure rates are high thanks to modern regimens. And if lymphoma comes back, New options like CAR T-cell therapy and targeted biologics are giving people more hope than ever. When I heard I was stage 3, I chose to go all in with conventional treatment, chemo and immunotherapy. And honestly, it made all the difference. I felt it working. The truth is, lymphoma isn't just about the medicine. It's about learning to live with the uncertainty and still find peace in the process. I've been in treatment, I've been in recovery, and I've learned that hope can live right beside fear. No matter your stage or type, there is hope. And every year, new treatments are helping more people thrive. So now you know what lymphoma really is, what those terms mean, and why there's more reason for hope than fear. If you've been diagnosed, or someone you love has, you're not alone. I'd love to hear your experience. Hodgkin's, non-Hodgkin's, indolent, aggressive, whatever it is, share it in the comments. You never know who your story might help. Lymphoma can sound overwhelming, but once you understand what's happening, it gets a little less scary and a lot more manageable. If this helped you or someone you love, please subscribe. It really helps this community grow. And I share new videos every week about real experiences, treatment insights, and ways to feel stronger through it all. And if you'd like to learn how to support your body during treatment, these next videos walk you through what really helps on the hard days.